Hello. Finally got the kids to bed, heading on my evening walk, and I wanted to talk a bit about perinatal mental health in light of Flora's walk that we are hosting on Saturday in Minnedosa to bring awareness and to raise some funds for perinatal mental health in our community. So what is perinatal mental health? Well, perinatal period is anytime from conception of pregnancy or attempt at conception, so that includes trying to conceive, all the way up to 2 years postpartum. So it's a massive period of time in women's lives. During this period of time, individuals or couples who are trying to conceive, pregnant, or postpartum are much more at risk or susceptible to mental health concerns. These could include anything from anxiety, depression, OCD or obsessive thoughts leading to compulsions, worsening ADHD, insomnia, or all of the above. Perinatal mental health is extremely important and actually quite prevalent, meaning that it's pretty common. Anywhere from 13 to 30% of individuals going through the peripartum or perinatal period will experience a subtype of mental health, whether that be anxiety, depression, etc. Despite this prevalence, it's a very underfunded, under-resourced area of healthcare, and definitely not an area that's talked about or promoted or educated. Unfortunately, one of the first symptoms that we experience is a decrease in insight. So we might be struggling, we might be having these recurrent thoughts or worries, we might not be sleeping well, we might not be looking after ourselves, but we don't actually recognize that. Usually it's somebody around us or something happens before we actually say, oh yeah, this is a problem. Some of the symptoms of postpartum depression are low mood, difficulties bonding with baby, withdrawal from your social network, including your partner, difficulties concentrating, poor appetite, thoughts of, your family or your baby might be better off without you. That's what we call suicidal ideation. This is important to differentiate between the baby blues, which occur in the first 2 weeks postpartum and are defined by mood swings, crying, fatigue, irritability, overwhelm with both the positive and the negative emotions. Postpartum depression continues on past that 2-week mark. It's these reasons that peripartum care is so incredibly important, to educate your patients, the people in their community, their support network, to look out for these signs and symptoms, but also how to treat them, how to prevent them. Our first course of action is to talk about it, to make our partner or family member or loved one or friend aware that you might have a concern. And if you're lucky enough to have a family doctor, make sure you let them know. Talk to your obstetrical provider, talk to your pediatrician, talk to your public health nurse, just talk to anybody that you can. Next, it's important to focus on our basic human needs. Are we getting sleep? Are we eating? Are we drinking? Are we peeing? Are we pooping? Are we making connection? There continues to be so many women, men, couples, families affected by perinatal mental health concerns, untreated, undiagnosed, undereducated, and that's not our fault as a people. That's our healthcare system. That's our resources, our lack of resources. It's my personal mission and our mission at the Wellness Clinic to make sure that we're educating, empowering our women and their families to be able to take the best possible care of themselves. And our step that we're taking this week is by raising awareness, raising funds, and helping bring light to this issue. So please, if you can, join us in Minnedosa on Saturday for Flora's Walk. And if you can't be there, because I know you guys live busy lives, donate. It goes to various resources in our community.